And really, I think through our work, we to have an integrated approach to support the whole person, whole families. We realize people don't live in, little agency silos. And so trying to interconnect and bring all that together is a lot of what we can bring to the table. So the first area, our impact area I'll highlight is for economic opportunity. And the number one issue that came up for us was from our nonprofit partners was to address the benefits cliff. And if you're not familiar with that term, it's where a family might be on receiving some government benefits and they receive increase in wages. It could be a promotion, increase in hours, but increase in salary of some sort. It's usually fairly small, but just enough to make it so they're not eligible for some of the programs and fundings that they're getting, the benefits. And so by taking that adjusted income, their family net income slides backwards. So it's this cliff effect. This really keeps either families dependent on public assistance, and many will say no, they don't want to lose those benefits, so they will pass by an opportunity to advance their career and their work, or it'll put them in a really precarious financial position where they might be in a place where should something happen, they could lose their housing or something. So it is absolutely at the heart of what systems change is all about. This is a system barrier. So our goal is to really smooth out those pain points, to provide pathways for family to move toward economic independence and ultimately into wealth building. The two areas is one, we want to extend the income and benefit reauthorization for MFIP, the Minnesota Family Investment Program. Currently, it's every month. So you've got these families that are in and out of jobs and it's very unstable in terms of income. We want to create a 6-month process so that they're reevaluated for eligibility every 6 months. We also want to make sure that when they are evaluated, it's based on the previous 30 days of income versus 60. So really trying to look at their current situation. And this is really a 2-gen approach. We know that children are parts of these families. They're absolutely at the center of an MFIP program. So we want to make sure we're creating that stability for the family as they try to grow into their jobs and workforce and do training as well. And then the other piece is for medical assistance eligibility. There's a proposal out that, again, sort of this 2-gen approach where children are seeing this volatility based on parent income. So if they're to lose MA eligibility, the children that are under 18 can keep continuous coverage for 12 months or a whole year. And we know that there's huge disparities in health outcomes. We know health is obviously linked to educational outcomes and others. So feel like this is a really important first step in tackling some of these bigger issues. There's a lot more to come, but this is a first step that we want to get involved with. Our second area is household stability. Housing itself is like consistently the number one issue that we hear from callers from 211. We received over 485,000, almost 500,000 contacts through our 211 system in 2021. 60% of those were related to housing, needs, issues, and concerns. So, our focus at United Way is really on the prevention of homelessness. So what we're looking at is increasing wraparound services to support the whole person, address root causes of homelessness, and get ahead of it to ideally prevent it before it happens. So this could include case management, like rent assistance, childcare, mental health supports, absolutely, job training, etc. A couple other pieces, certainly we're part of the Homes for All Coalition, so definitely work a lot with Sue. A lot of these issues, sometimes we're focused a little differently, but we all work in alignment. It's a bonding year, we want to absolutely preserve and increase affordable housing. So that is absolutely a need in this region. It's at a crisis level. We also want to support creating a dedicated funding source for affordable housing construction. And then we also know eviction prevention is homelessness prevention. So we are also working on eviction policy reforms and a greater equity in those processes. So our last impact area that I'll kind of highlight is educational success. Education has long been a foundation of our work. We know that over 30,000 families and children are unable to access the early care that they want and need. So we're really focusing and continuing our long focus on increasing investments in early care and education, the access to that. So that could look like early learning scholarships. It could be home visiting, supporting child care assistance program. They're all very important and need to work together. But we can't talk about that without talking about the workforce. And so we want to stabilize a very fragile early childhood workforce sector. We know that early childhood is so important for brain development, but yet it's an unsustainable business model. Many providers are leaving the industry, they're closing their doors. And we need early childcare, not only for that brain development we talk about and healthy, safe opportunities for them, but we need to allow parents to go to work and support a thriving community. And we know that's also a top issue.